So today I want to talk about one of the most common questions I get asked by my patients, but also the danger behind the answer to it. And that's, Doc, what's my diagnosis? Do I have ADHD, autism, depression, trauma, OCD? All of these questions are very common, understandable, and part of the course of seeing a mental health professional. But beneath it, there's another question people are often asking. Because what people really want to know with that question is this: if I get the right diagnosis, will that finally explain me? Will I feel better understood? And will life make sense? And will I be pointed towards the right treatment now? So today I want to explore that question a little bit further, reveal what a diagnosis can actually tell about you, and more importantly, what it can't, and some of the dangers of latching onto a diagnosis too tightly. And for those of you who are new to the channel, welcome. I'm Dr. Robert. I'm a board-certified psychiatrist. And in today's educational video, we're exploring mental health diagnoses. So first off, what is a mental health diagnosis? Because it is different than some other medical diagnoses, let's say like in cardiology, orthopedics, or other medical specialties, where there are more clear-cut lines and distinguishing factors that determine whether you have a certain diagnosis or not, like diabetes or tuberculosis, right? Mental health is different. There are no blood tests, no scans that can identify a certain diagnosis. Rather, they're clusters of symptoms, often subjective symptoms that we all experience a little bit differently, that we see in patterns that kind of group together. And so we label those, using the diagnostic statistical manual behind me there, to label them under a certain diagnosis, like major depressive disorder or generalized anxiety disorder. And if you are curious to learn more about the DSM, how we make mental health diagnoses, and some of the many flaws that are really shocking for many people, definitely check out my full video on that. It was one of my first videos. I'm really proud of it. I'll put the link down below. But the main thing I really want to summarize about mental health diagnoses is they're not very discrete entities. There's a lot of overlap between symptoms. You can have anxiety and PTSD, OCD, generalized anxiety disorder, panic disorder, depression. And so one subjective symptom can be part of different diagnostic categories. And we should view mental health diagnoses as just these kind of frameworks, never anything concrete. There's nothing black and white in mental health. Mood, anxiety, attention, all of these things exist on spectrums. And they might be a little bit better one day than another. What the DSM, the Diagnostic Statistical Manual, does by creating diagnoses is it tries to draw lines on these spectrums. So often when my patients are asking me that question, do I have this diagnosis? They're asking, is my experience of, this anxiety, this inattention, is it to the degree that it warrants a diagnosis? Does it meet that criteria? So let's say I do give a patient a diagnosis. Then typically their next question will be, well, great, now I have a diagnosis. And now you can point me, steer me towards the right treatment, and then everything will be fine, right? No more problems, right? Not exactly. Sure, there can be a lot of overlap, right? Let's say SSRIs, the most common medications we as psychiatrists prescribe, things like Prozac, Zoloft, Lexapro. They can treat a full spectrum of different mental health conditions. Let's say PTSD, depression, OCD, anxiety, many, many others. So that can be a very common tool, but then still choosing which SSRI, to what dosage. Well, we have to try another medication, but that's still uncertain. So we don't really fully know if that would be the next best step, but usually that's a good starting point at least. Hey friends, I want to add an extra little piece here, because most of us mental health care providers, when we're hearing people out, treating them, we actually focus on symptoms, what people are experiencing and reporting to us, even more so than the overall diagnosis. We listen to people experiencing low motivation, trouble with sleep, appetite, anxious ruminative thoughts, and then we tailor our treatment approach, whether that be medications, therapy, lifestyle changes, diet, all of that to target those symptoms even more so than diagnosis. Of course, diagnosis is still important. I hope that adds some clarity. So yes, having the right diagnosis can certainly help steer the course of treatment, but it doesn't mean you'll get to the destination, you'll get full symptom relief right away. So again, it's still just a framework that you're working with. Another misunderstanding that tends to come up with the question, what's my diagnosis, is single cause thinking. And that's believing that a single cause, a single issue, then leads to a diagnosis. I would say that's very, very rare. It certainly happens sometimes, but that's the extremely rare exception. There's usually multiple factors and layers behind a certain cluster of symptoms that we then classify as a diagnosis and someone's experiences as the stress in their life. And that's because mental health lies at an intersection of many various interacting systems. And that's culture, biological vulnerability, personality structure, developmental history, trauma, experiences in life, and many, many other factors that all play a role as to how you experience certain mental health symptoms, or just reality in general. Maybe a little analogy for that. If life is a book, A diagnosis is maybe a little chapter in it at most. Just pick the biggest book I could find on my shelf. I've actually been considering doing some mental health videos where I go through historical figures like Mark Twain and try to list off and explore some of the mental health diagnoses that could have been at play. Definitely some ADHD with Mark Twain. I suspect it. And now to the potentially controversial part. When diagnosis becomes identity. This is when a diagnosis stops becoming something that someone has and starts to become who they are. And this is a delicate subject, so definitely tread lightly here. Because I understand for many people, especially for people in the ADHD, autism spectrum, and other neurodivergence communities, they definitely find that their diagnosis reduces the shame that they've experienced throughout their life and helps them better understand themselves. There's definitely a lot of credit to be given to that. It certainly reduces shame, self-blame, and just a lot of stigma. But I do think that there is a subtle shift that can happen in people on occasion that isn't very healthy or helpful. And that's when they start to think, this doesn't explain some of my experience, this explains all of my experience. Now, every forgotten appointment or distraction becomes, oh, that's my ADHD. And every social discomfort or odd quirk becomes my autism. Or an emotional fluctuation becomes bipolar disorder. Because sometimes these things may be true and sometimes they may not. But what I do believe that is happening sometimes is it becomes very reductionistic, just to narrow people's identity. And rather than experiencing life, they get fixated on life through the lens of a diagnosis, which can inadvertently sort of shrink their scope of experiences. Because if every setback, every frustration is then filtered through the lens of your diagnosis, it reduces some of your agency. And in my experience, some of the most resilient patients are the ones who are able to acknowledge a diagnosis, but not become too fused to it. It can help reduce some of the shame, create some understanding, but that's all it does. They're still able to then take their own agency towards moving forward, creating an identity separate from their diagnosis, even though it may be influenced by it. I think a big area where this has really sort of exploded in the last few years is just on social media. I don't really use TikTok or Instagram that much, but I've definitely seen a lot of videos of just people really fusing with the diagnosis and it becomes a part of their identity. And the main thing that they want to filter every experience through. And I think that can become very limiting. And of course, that's just a little snapshot of it, what you see on social media. But I think then that is then picked up by other people who then self-diagnose themselves, come to providers wanting a diagnosis that confirms what TikTok told them. I worry that that can reduce the experience of people who actually have the diagnosis or struggling with it. Or, even if someone does actually have the diagnosis, they meet the criteria, it sort of narrows their range of experience or too closely fuses them to the diagnosis and makes it harder for them to live past it, grow from it. Because the diagnosis should add clarity, not restrict identity. But please let me know if you disagree with that. As I'm talking about it, I definitely understand why people want clarity, right? I think that instinct of what's my diagnosis? What's the path forward? What can I identify with are just such natural, understandable questions for us to ask. Because as an anxiety doctor, I very well know that our brains chase certainty. They don't like ambiguity. And I think a lot of social media these days too can sort of latch onto that and exploit that to give you a sense of this is what I have, this is what I need to do. When in reality, that's not how it works. Even though TikTok may tell you otherwise. But maybe that's a video for another day. Thank you so much for sticking around to the very end. I really appreciate your attention. Let me know if you have any questions about mental health diagnoses or anything else mental health related. I'd love to answer them, perhaps make future videos on it. And I really appreciate you and I hope to see you next week. Thanks.